Picture this: every breath you take feels like it's never quite enough. Your chest feels tight, you're constantly catching your breath, and coughing is now part of your daily routine. Sound familiar? If you or someone you love is experiencing these symptoms, you're not alone. In fact, they could be signs of something serious, COPD, or chronic obstructive pulmonary disease. It's more common than you might think, and is actually the third leading cause of death in the United States. Early diagnosis is key, and a critical tool in that process is a simple chest X-ray. Why a chest X-ray? Let's dive into why doctors rely on chest X-rays to diagnose COPD. An X-ray isn't just a picture, it's like a map showing what's happening inside your lungs. Imagine trying to find your way through an unknown city. You'd use a map to see what's there, right? A chest X-ray does the same thing. It shows doctors the path of COPD and reveals how far it's progressed. X-rays are often ordered after doctors notice signs like persistent coughing and excess mucus, shortness of breath, tightness or pressure in the chest. While X-rays are not the only test for COPD, they're an important piece of the puzzle, helping to identify the specific physical changes that occur in the lungs due to this disease. Let's explore what doctors are looking for on an X-ray when diagnosing COPD, and how these images reveal what's really going on. What an X-ray shows in COPD patients. On a chest X-ray, certain features may indicate COPD. Doctors look for these signs to assess lung damage and measure how the disease is affecting your body. The common markers they check include: 1. Hyperinflated lungs. Imagine blowing up a balloon so much that it nearly bursts. That's essentially what happens with COPD. Due to damaged lung tissue, air gets trapped inside the lungs. This overinflation can lead to larger than normal lungs on an X-ray. With every breath, less air is exchanged, which makes breathing feel strained. Hyperinflation makes the lungs appear unusually large on the X-ray, reducing the air exchange you get with each breath. 2. Flattened diaphragm. When the lungs are overinflated, they push against the diaphragm, the muscle below the lungs that helps us breathe. A flattened diaphragm is like a stretched out spring. It can't function as efficiently. This can make it difficult to fully exhale, trapping even more air in the lungs and causing more shortness of breath. Doctors spot this feature on the X-ray and know it's a classic COPD sign. 3. Air pockets or bullae. Think of a bumpy, pothole-filled road. Bullae are like those potholes inside the lungs, pockets of air caused by destroyed lung tissue. These air pockets take up space, so there's less room for healthy lung tissue to do its job. Bullae not only make it harder to breathe, but they also pose a risk of bursting. When they grow large enough, surgery may be necessary to remove them. 4. Narrowed heart. As the lungs expand, the heart has to adjust to fit. With emphysema, a type of COPD, the heart often appears narrow or elongated on an X-ray. This change happens partly because the heart may shift slightly to accommodate the lungs, but it's also due to reduced heart volume, especially on the left side. An X-ray provides a visual clue that the lungs are affecting the heart's position and structure. 5. Changes in airways. Finally, doctors examine the airways themselves. Narrowed or irregularly shaped airways can signal early COPD. Changes in the airways make it harder for air to move in and out of the lungs, which adds to the difficulty breathing. Although subtle, these signs are enough for doctors to consider more tests or treatments. The X-ray process. What to expect? Getting a chest X-ray for COPD is simple and quick. You'll stand in front of the X-ray machine, remove clothing from your upper body, and wear a hospital gown. Typically, one image is taken from the front and another from the side, so doctors can see your lungs from multiple angles. If standing is difficult, you might lie down for the images, especially if extra fluid in your lungs is suspected. Some may worry about the radiation, but the amount is minimal, especially compared to the benefits of an accurate diagnosis. If you're pregnant, though, always inform the technician, as extra precautions will be necessary to keep you safe. Beyond the X-ray, next steps in diagnosis. After the X-ray, doctors often order a CT scan. Unlike the flat X-ray image, a CT scan provides a 3D look inside the lungs, revealing even more detail. It's like switching from a regular map to a GPS view. With a CT scan, doctors can examine the tissues and pinpoint areas of damage, spotting changes that might not be visible on a standard X-ray. This comprehensive view helps doctors refine their diagnosis and track disease progression. However, imaging tests aren't the whole story. To get a complete picture, doctors will also test your lung function, often using spirometry, a test that measures how much air you can breathe out and how fast. This information, combined with imaging results, guides doctors in identifying the stage of COPD and determining treatment options. Why a timely diagnosis matters. A COPD diagnosis is a critical first step, and time is of the essence. The sooner you understand your condition, the sooner you can start managing it. COPD may be incurable, but treatments can slow its progression. With the right treatment plan, symptoms can be managed effectively, helping you maintain a better quality of life. Doctors classify COPD into stages, from mild to severe, based on symptoms and test results. Starting treatment early, even at a mild stage, can make a world of difference, helping to reduce symptom flare-ups and keeping your lungs as healthy as possible. What you can do now. If you're experiencing symptoms like breathlessness, a chronic cough, or chest tightness, consider seeing your doctor and discussing the possibility of an X-ray. Early diagnosis can empower you to take control of your health and improve your outlook. Being proactive, understanding the role of tests like X-rays and CT scans, and knowing what to expect can give you a head start on managing COPD. By keeping an eye on your symptoms, scheduling regular checkups, and following through with recommended tests, you can take the steps needed to breathe easier. Closing thoughts. COPD may seem daunting, but knowledge is power. Understanding the role of a chest X-ray and what it can reveal about your lungs is one step toward taking control. Every X-ray, every test, is a piece of the bigger picture, a picture that allows you and your doctor to map out a treatment plan, manage symptoms, and keep living your life. If you've been experiencing the symptoms we discussed, talk to your doctor. Remember, the earlier you catch it, the more options you have. Take charge of your lung health, and breathe a little easier knowing that you're not alone on this journey. The path to better health starts with understanding your body and making informed decisions about your care. So, take that first step today, and remember, you've got this.